For today's episode, Nicole Rincon returns to tell us about risk factors associated with pregnancy and autism. Nicole will take us through a pre-pregnancy topics to increase our awareness and tools to consider for reducing the rates of autism. In addition, she will take us through pregnancy and postnatal factors commonly associated with autism. Some of these factors are from the environment, and some of these biological considerations and biomarkers that, at times, can be seen in blood work. With her 17 years in medicine and her drive as a mother, Nicole offers tremendous knowledge on the topic of autism. And now, today's episode with Nicole Rincon. Nicole, let's start with pre-pregnancy, and maybe we can get into some factors such as prevention and some sort of awareness, maybe biomarkers or lab works that can be done, and some environmental factors.
Yeah, thank you, Ryan, for having me on today. I really appreciate it. It was really fun last time, and I love chatting. And I did want to have to preface, every speech with just this is not direct medical advice that I'm giving. So, of course, anything that I'm saying, don't take it as a prescription. Please talk to your doctor about anything you're going to do or try during pregnancy or with, any medical intervention. So, thank you for having me on about pregnancy. I wanted to, talk about it because it's really important. I think as autism awareness is increasing, and it's important for mothers to understand that there is a familial kind of inheritance with autism frequently. So there was one study that showed that almost 19% of kids with autism have an older sibling with autism. So, if you have one child with autism, you're much more likely to have another child. It's up to like 6 times the risk rating. So prevention can be key. And also it's interesting because when they looked at maternal and paternal half siblings, there's even an increased risk in each direction. So for half siblings on the maternal side, if you have a sibling with autism, you have a 2.5 times greater rate of having autism. And then if you have a paternal sibling, half sibling, it's a 1.5 greater risk. So it does appear that like the genes on both sides do affect pregnancy. So we're going to talk about maternal risk factors, but it is also important. Dads are important too. And so their health does matter in the contribution of having healthy children. So I just wanted to point that out. And I also wanted to just kind of start the talk saying that, there was a cool study that showed that maternal knowledge of environmental toxicants lowered the risk of having children with autism. So that's why I want to do this podcast, because the more moms know, the more they can avoid things and do the right things, take the right things. It does lower your risk. So it matters. It very much matters. And I know an ounce of prevention is worth a pound of cure. So we're really trying to make sure that we get as many healthy babies being born every day as we can, and not have to try to reverse some of the effects of autism that we see. So that's kind of my intro. You wanted to kind of dive into maybe some maternal risk factors. Is that right, Ryan?
Sure. Yeah. Because I'm absolutely in agreement with you, because this information ought to be out there, and if it's just one child saved, then perfect.
Yeah, absolutely. And like I said, it's important. Mumford did a cohort study. It was a pretty big study in 2013. Now it's a decade old, but she kind of did a pregnancy summary, talking about various risk factors, and there does appear to be a lot. So it's not just 1 or 2 big risk factors. So for the sake of this podcast, we'll kind of touch upon the most important that we found, and also the most modifiable, because some things that's like, well, genetic, like race, or one study showed that being white or Asian was an increased risk versus being other races for having an autistic child. And obviously we can't change that. So, but there are a lot of things you can. So then this Mumper study, she talked about environmental toxicants being a major risk factor. And there are other things like gut flora, maternal gut flora. So having a mom that had dysbiosis was a risk factor. Medications were part of those toxicants, such as the big ones that they identified were Tylenol. So I really advocate for moms to not take Tylenol during pregnancy because it has been significantly correlated with autism in children and offspring. The other medications they talk about is antibiotics. So moms that took antibiotics during pregnancy had higher likelihoods. And again, that's a really complicated topic. Is it because it caused dysbiosis, or was it the infection to begin with that was the risk factor, or was it the actual some kind of a toxicity from the antibiotic? And it's hard to kind of tease apart. But again, these are things like if mom's having GI issues, for whatever reason, severe constipation, diarrhea, irritable bowel syndrome, things like that, you should identify that prior to conception. And she also mentioned, breastfeeding duration was a risk factor. So they talked, and we'll talk later about post-conception strategies, but I'm sorry, postpartum strategies. But breastfeeding for at least 6 months actually significantly decreased the risk of autism too. So breastfeeding is an important thing. And there are some other toxicants that other studies have pointed out. So there was another one. Dr. Rosignol actually did a review study, who I worked for in 2014, and he identified the two biggest toxicants were air pollution and pesticides. So there's been a big correlation, even just with, the 2.5 ppm, like the kind of air pollution from vehicles and things that are associated with autism. So there's a big urban correlation. So kids that live in bigger urban cities actually have more autism rates versus living in rural areas. And, that may be correlated with air pollution. Studies, there was another really cool study that showed that living next, it's not cool, it's unfortunate, but living next to a freeway, I believe it was like 300 feet. It was really relatively close, like a block away from a freeway, increased the risk of having autism in their offspring. So they actually did a study that showed if you were in this radius from the freeways, you had a higher incidence. So that it does appear to be, some have an impact. Pesticides, and this was again a study done a decade ago, but pesticides do appear to be big mitochondrial toxins for certain people, especially with genetic susceptibility. So living in agricultural areas where they use a lot of pesticides, or living in areas, where just like maybe Florida, where they're using a lot of pesticides routinely, or, frankly, eating non-organic food and having pesticides ingested in your daily meals can correlate. There's a gene called PON1 gene that I've seen it in some of my patients where, these kids are profoundly sick with pesticides, and you test them and their organophosphates, they're through the roof. And, removing that mostly with strict dietary, restrictions of intake of pesticides can really improve outcomes, improves their mitochondrial function, their speech, their cognition. So yeah, like I said, we can go on and on about risk factors. Did you have any questions about those specifically?
Yeah, it was very fascinating as you was explaining that, because of and you, as anyone, as well as anyone, that our mitochondria is from the maternal side.
Yes.
And they're exposed as everything that you were describing. So the child's mitochondria,
Mm-hmm.
and that being such a huge factor for our cell health and our nervous systems. And then I was thinking about the gut flora, about the pregnant mother, because during some research I found that the maternal peripheral, or specifically the pancreas serotonin,
Mm-hmm.
provides serotonin in the womb for the central nervous system of the
Mm-hmm.
child.
Yeah.
So that was just wow to me, because of this is obviously kind of dysfunction in our modern society, and autism, as we know it, as a low serotonin or serotonin dysfunction in the central nervous system, is a big factor for autism. That direct relationship there was just like, oh my gosh.
Yeah.
I was just wondering if I have a couple of questions though.
Yeah.
Are there alternatives, parents or maternal can use besides Tylenol if they choose this route? I think best probably is to avoid it, but if
Yeah.
they need to,
So that's a difficult one, unfortunately, because you can't take ibuprofen. I mean, general medical wisdom is you can't take ibuprofen during pregnancy, um, because it causes a certain hole in the baby's heart. Basically, it's not indicated and can be dangerous for the fetus. So you don't want to
yeah,
take it. So a lot of times it's kind of looking at alternative routes. I typically would try to do kind of natural anti-inflammatories, and we can talk about this later. But it's part of my workup is that, well, why are you having pain to begin with? Is there,
yeah, yeah,
do you have inflammation? Because
yeah.
typically, you're going to correlate with pain with inflammation, and sometimes there's just organic things that you had a back disc herniated a long time ago, and sometimes there's just structural issues, but a lot of times there's inflammation associated with that, especially with most moms that are young, less than 40. I mean, there shouldn't be some consistent pain unless there was an accident or whatnot. But yeah, reducing inflammation can be key. So we can try fish oil is a big one, and other supplements that help, like the omega-3 fatty acids, like I mentioned, and other things that can help reduce inflammation to begin with. So the goal is to iron out, if you're having chronic pain before the pregnancy, what's going on, and let's address
Yeah,
that first.
yeah.
So and I had really bad during my pregnancy. It was probably during the last trimester. I had really bad headaches, and I don't know. Now kind of looking back, I was thinking I was having histamine intolerances because, again, during my pregnancy, I had a dysbiosis. I was having GI problems. And I don't think I adequately addressed them before I got pregnant. And, I just kind of did fertility treatments and I got triplets and yay. But, had I known, I would have gone about it differently. And, I just kind of, the doctors were like, let's do an MRI on you. Why are you having headaches? And, I refused. I'm like, no, I don't want any testing. Like, I just, and so I was trying to work with food. So I cut out some dairy towards the end of my pregnancy, and it actually helped. So figuring out where the source of the pain is, what's causing this inflammation. So instead of just giving a med that's treating things downstream, let's try to go upstream and see where it's coming from. So yeah, it's a really good question.
Something else that I pulled out of that first few minutes there about the freeway, and I was wondering if like of course the pollution is obviously there, but the amount of light, especially at night, because
Okay.
I'm so fascinated with you can see pictures from space,
Yep.
uh, like the 40s, 60s, 80s, 2000s to current day,
Yep.
and it's just increasing.
Yep.
The nightlife is
Mhm.
just so bright across our societies now.
Yeah. Yeah, it's
So,
possible. I mean, I know you're really into studying
yeah,
light and the
yeah,
effects of light and, seasonal, like I was going to bring up seasonality of birth.
yeah.
So there was one big study, and it was a really, really a large cohort. It was over 6 million kids they looked at. So a very large study looking at what season was most correlated with autism.
Mm,
And they found that conceptions with December through March had the highest rates. And conversely, summer had the lowest rates. So there is something to that of having that natural light, and being maybe have a longer length of light, like because summers are the longest days.
yeah, yeah.
And so yeah, that maybe have a big impact. And interestingly too, if you look at the demographic of geographic location, this was a study, it's probably a decade old now too, but it showed that people in the northeast, so like New England area, had the highest incidence geographically of autism, versus the southeast had the lowest. So maybe the further towards the equator, you're getting more sunlight. Who knows? Or maybe there's, like you mentioned, there's just more urban areas in New England. There's Boston and New York, and if you're living, there's a lot more people populated in urban areas. Versus if you look at like New Mexico, there's not going to be as many urban areas per
Yeah.
population. So densely populated, of course. So yeah, it's really interesting. And to talk about your serotonin, I mean, the studies are very, they're all over the place. They used to think,
Mhm.
when I was first reading these studies with serotonin, they used to think that it was a hyper serotonin state, and that caused autism. So what they did was, as an experiment, there's a ton of studies. A bunch of doctors trialed fenfluramine, which actually has it used to be part of the fen-phen, it was the weight loss drug. But what they found is it had novel anti-serotonin properties. So these doctors all theorized, well, let's give an anti-serotonin agent and see how they do. And they did study after study, and there were a little bit of results, but most of them were not successful. And so they found that actually driving down serotonin didn't really help kids with autism. So I just was reading a paper actually yesterday on tryptophan, which is kind of the precursor to serotonin, and they found that they starved out kids with tryptophan, and then they gave them like for 24 hours, and then they gave them some of them placebo, which is like no tryptophan, or they gave some of them back tryptophan, and there was a wide variety of results. The kids that had high serotonin states and then dipped down to very low serotonin states had really abnormal behaviors, so they didn't seem to tolerate low serotonin. Versus the kids that had moderate, when they dipped down, they seemed to do okay. So it's interesting, there is a relationship with serotonin, and some kids do very well with SSRIs on the spectrum, actually increasing serotonin, and some kids don't. And I think there must be a subset. There must be a gene type. I think it's probably associated with the microbiome. And maybe methylation, maybe going back to that folate, like we talked about. So, it seems like what we need to do for the future, in my opinion, of autism is kind of tease apart different kind of types of autism, or what, this is the gut bug kids that seem to have Clostridia and they have too much propionic acid and then they're not converting dopamine to norepinephrine. This is the group that has too much serotonin and they respond to these, and we try to do that. We try to do that organically in our clinic by looking at the markers and treating individual kids. But there may be. I would hope there would be a better way to kind of delineate groups, but we're trying.
So what I know about inflammation from studying like quantum physics and whatnot is inflammation is too many protons. So that means there's not enough electrons, which is also with a lot of the topics that we're talking about now. But I was just wondering if mothers and fathers could increase their electrons, especially during those winter months, because it's apparent, it's obvious to me. Like during the winter, the Earth, northern hemisphere, is not getting those electrons.
Yeah.
I'm just thinking out loud there. I just wanted to say that.
Well, yeah, and I think I think is basically what you're saying is oxidative stress, and that oxidative, that redox where they lose an electron and then your body has to gain it, and you kind of go through this process. And so yes, there's too many free radicals, and that can cause inflammation and a lot of damage neurologically, of course. And so, but there are other aspects of inflammation too, and as far as immune modulating aspects. So there's TNF alpha, and there's other immune responses that can trigger this as well. But yes, it kind of, Dr. Rosignol and Dr. Fry, I heard them at a conference once. They joked, and they're like, yeah, we're treating mitochondrial dysfunction, yes, but basically all we're doing is giving antioxidants. Everything's an antioxidant, and so they're all, and it's exactly to your point. And I think that the sunlight, yes, can absolutely serve that purpose, and I think it is, essential for health. And so yes, it's yeah, agreed.
That goes with the mitochondria, because of how much 95% of our melatonin is made in the mitochondria, and it goes back to that tryptophan, because that's also sequenced along the lines of serotonin and melatonin, and because that's might be our number one antioxidant. I don't know if it's number one. I don't know if we can subordinate them, but it's up there.
Yeah. Well, optimizing the electron transport chain is part of what we do for a lot of mitochondrial dysfunction. So a lot of these supplements like CoQ10 and carnitine can very much help support those processes and make sure that we're not losing a lot of energy, and we're not creating a lot of free radicals while it's going down that chain to produce ATP. So it's very crucial. It's all kind of related.
Isolated blue light will create free radicals from vitamin A out of high form. and it destroys the lipid rafts and the mitochondria and stuff. And
Yes.
that's also goes in line with the rates of being exposed to artificial light and avoiding sunlight and the types of artificial light.
Yeah.
But that's all complicated, and I want to make this
It is.
more about what fathers and mothers can do. So I was wondering if there are options or alternatives to things like antibiotics.
Yeah, so that's a really good question. And, a lot of these things, again, this is, we don't typically do. So my goal is to optimize the mother's health while or before conception. So looking at these things, I try not to treat, we really don't treat like, we're not a primary care, we're not a gynecologist, a OBGYN, practice. So for a lot of these things, we do defer. And some things, with maternal infections, you do need to address, the mom. I mean, if you have an infection, it may be more dangerous, of course, to leave that untreated. And not all antibiotics are created equal. And even, general medicine kind of knows that. And so the least invasive, the better, so it's a very case by case. I wish I had some straightforward answers. There's things that we could look at and usually figure out, what the infection is and what's the safest antibiotic, or even herbs. But some herbs, you got to make sure they're tested during pregnancy. So I'm always very wary of telling moms, to take herbs because, you want to make sure that you know what's safe. It's so, like I said, for that, a lot of it is, preventing the infection to begin with. So, I talked about it with, just autism treatment in general. And a lot of the things look very much the same, making sure that you're not eating foods that have a lot of herbicides like Roundup, which can cause a dysbiosis. And that will definitely trigger. So eating an organic diet, eating whole foods without a lot of additives, which we don't know even half what the ingredients are, and so, for me, again, like with my headache during my pregnancy, a lot of times it's just reducing something bad that you're doing versus, and what kind of water are you drinking? Are you drinking tap water that may have arsenic or, too much chromium or, nitrates or chlorine? And so, really optimizing, the things that are going to keep your body healthy, because we're going to fight. I mean, naturally we get infections and we can fight them. A lot of times women, in a practice, if a woman has an infection like a gynecologic infection or even a UTI, like half the time a woman will recover naturally over a few days. We just kind of a standard of practice given antibiotics, and it gets a little sketchy. Like I said, it gets a little risky during pregnancy because you don't want to leave infections untreated. So, but the idea is to have your immune system working optimally so it doesn't get the infection to begin with.
So whenever a parent or a mother comes into you and maybe this is a bad question, but are there certain like lab works or biomarkers that you can see or kind of go to make sure the maternal is ready for conception?
Yes. And that's a really good point. So, what normally we'll do is, I like to do a panel. So if we have a mom, and a lot of times in our practice, it just happens this way where, we have a mom with a child on the spectrum and she wants to get pregnant again, or she happens to be pregnant. So we will look at certain labs, to kind of, like we said, try to mitigate those risk factors. So a big one is inflammation, like we talked about. So we'll get CRP, ESR. These are inflammatory markers, and ANA that kind of correlates with autoimmunity and inflammation. Yeah. And then a lot of times, those can be associated with GI dysbiosis, like, because if you're having autoimmune diseases, then there may be something wrong in your gut, some overgrowth of Proteus mirabilis or Klebsiella or whatnot. So we want to address that first. Another big thing that we look for is thyroid function. So having hypothyroid is a really big risk for autism and offspring. So we'll look at thyroid antibodies. We'll usually look at the TSH, which is kind of the standard screening, but we'll also get a free T3, free T4. Mm-hmm. And, if you see any red flags, we're going to treat. And you kind of want to treat more aggressively than a non-pregnant woman, even, because that really affects the development of the brain of the child. And so there's some things. So when we found that when we treat thyroid appropriately, the risk factors go down. You just give them either, Synthroid, or some parents prefer Armour Thyroid, which is a blend. And so you give them these medications, and it does seem to mitigate some of the risk. But of course, we're looking at, well, why do you have hypothyroid to begin with? Which usually, again, goes back to the gut. But usually infections or whatnot, chronic infections. So, those are things that we want to look at. But it is very important to treat. And so we try to optimize those doses as much as we can.
Yeah, we briefly talked about the thyroid and the tyrosine and that biosynthesis. And the T4, T3, the 4 and the 3 is iodine. Do you know anything about supplementing iodine? Or
yes,
if that
I was just going to say that. Yep.
Okay,
you got a great point. And it really, and no, it's a great point because iodine is really helpful, actually. Yeah. And so iodine is one of the big supplements. And any quality prenatal will have iodine in it to help support maternal thyroid. So there's usually that baseline. But if we're seeing thyroid issues, we can definitely bump up that supplementation. And, again, this is where you talk to your doctor because, too much can be bad. You can overdose on iodine. But you do want to make sure that you're supporting the thyroid, and it does actually help a lot. So yes, it's a good supplement to consider during pregnancy when used cautiously.
There are so many people with thyroid problems in our modern day. It's very concerning.
It is, and especially amongst females, and I see a lot of females with hypothyroid, and a lot of times they're kind of subclinical. So when I was in PA school, I did an endocrinology rotation, and I had a really great doctor. She was a brilliant woman. She's Dr. Kansa. I love her. And she would treat even more, more aggressively than the standard guidelines, which is why I liked her, because she was quite progressive, and she'd give everybody, she had a protocol of supplements. She'd give like MSM. And this was, oh my gosh, this was like 2 decades ago. But she would treat anybody with a TSH above 2.5. So in the standard of care, I don't know if you know, is 4.5. So she'd say, look, if it's getting above 2.5, it's slow. Like, it's getting tired. Let's just give it a little bit. And she wouldn't overdose or anything, but she'd give them a tiny, small dose. And most of the patients would respond really positively. We'd have people that were kind of depressed or weight gain or just not feeling very motivated. And they'd come back like, wow, I feel a lot better with this tiny dose. So she was very progressive. And I think that, you can talk to your doctor and see how much you can kind of, treat it, because it is very dangerous for the offspring, for your child to be, low when you're low on thyroid. And just one more thing about that too, coming back around to what we talked about in our last discussion, is that those hypothyroidism is associated with folate receptor binding proteins. So, how much of it is actually cross-reactivity? Is it their thyroid slowing down and they're not making enough folate? And their body's binding to folate receptors. So, usually when you see somebody with hypothyroid, you gotta, in general, that's a clue. That's a red flag in my mind. Hey, let's A, give them some more folate, and B, test those receptor antibodies and make sure that that's supported as well, because they usually go hand in hand.
Wow. So I just want to clarify, and I think I know.
Yeah.
Personal disclosure, I guess, is I've had thyroid problems, and I've had a lot of autoimmune problems, and I think it was all related. A doctor wanted to do A&A workup on me, and I was like, I didn't do it because I'm like, I don't trust the care. I don't trust it'll be fixed, because year after year I was getting another new autoimmune condition, and I was like, something's going wrong. That's really whenever I got into the sun and the grounding and the electrons. But you mentioned the low thyroid. Is that's associated with like low motivation and depression?
Can be.
Was that
absolutely?
Okay.
Yeah, it can be. And I think Western medicine is on to this. I have a lot of, colleagues that are, just doing, primary care, and they do seem to look at it. They understand it. I think they're on the right track. I think that what I find is that they're just kind of under treating. I think that the endocrinologist I talked to 2 decades ago, she's like, we can really start treating earlier before their thyroid gets so fatigued. Now, ideally, like you said, we'd back up 10 steps and say, well, wait a minute, why are they getting thyroid to begin with? Do they have immune dysfunction? Why do they have immune dysfunction? Is there metal toxicity? Is there some kind of genetics? Are they having, MTHFR mutations that we need to give more folate? There's a lot of things that we can do backing up to see, like you mentioned, a lot of autoimmunity comes from the GI tract. So they know that like when they've done a lot of studies, and this is kind of well established, that something like rheumatoid arthritis, RA,
Yeah,
is correlated with often, not always, but often Proteus mirabilis overgrowth in the gut. It's a gram-negative rod. It produces a lot of LPSs, those lipopolysaccharides. It's hugely inflammatory. It loves to colonize the GU tract, the urinary tract. So it causes a lot of UTIs, but it also just causes a lot of joint inflammation. So a lot of this stuff's like, well, wait a minute, what's going on? And so this is where really in-depth GI testing comes into place, because a lot of people have a lot of funky things growing in their gut that they just don't know, because, like primary care medicine doesn't test for it. They'll look for a C. diff toxin or, salmonella or so O&P. They'll do a basic parasite test, but it's not very inclusive. And that's kind of all they test for. But it's so much more complicated than that. And it's really the cornerstone of a lot of autoimmunity. Wow. So okay. that's always my, but I love the GI. I love the gut. I think that the science, I really try and match like probiotics with the specific gut profiles. I have a ton of probiotics in my arsenal that I'll recommend based on symptoms, and there's not just one size fits all. I think it's a huge undiscovered, science that really can be super impactful. So yeah. And like you said, it's, and one more thing just to that end is that you're talking about your story, and, and I totally agree about these rising autoimmunity, factors. And a lot of things that we talk about in a functional medicine practice, in an integrative medicine practice, is stress. And, who knows what was going on in your life during that time? I certainly, with my life, I think that I was having a lot of pregnancy problems early on in my first trimester. And I took a leave of absence from work because I was starting to get bleeding, and so they put me on disability, and I just sat in a bed all day. And frankly, it was just glorious. And I hadn't sat down in forever and just watched game shows. And a lot of my issues got better. And I found that I just needed to lay down for a few days. And, and my body was like, and I kind of stopped bleeding, and I felt I just was in a better mood, and I was sleeping better. And I'm like, oh shoot, I was just doing too much at one time. I was putting too much pressure. It was, and so, a lot of this is going back to the basics, like sunlight, grounding, sleep, stress reduction, and really not how can we take away things from your life that is causing disease versus adding in antibiotics versus adding in more drugs, right?
No, that was so good. Yeah. That comment was so good. What are it's
important. Mm-hmm.
Yeah. What are some of the things that we haven't talked about with the folate and like the folinic acid? And it seems to me, from my perspective, there's so much with the folate and different options. Yeah. Is that something that can be tested like pre-pregnancy and monitored through pregnancy?
Again, just like the kids, yes. So we'll usually do MTHFR to see how well they're just methylating their folate in general, and that will kind of dictate how much maybe methylfolate they get. And somebody pointed out online in response to this podcast, it is a lot more complicated than just one gene. There's COMT genes, and there's a lot of what's called SNPs, single nucleotide peptides, that really interact with how your body runs these big metabolic processes. So some people don't do well with a ton of methyl donors, so you can't put them on too high of a dose of methylfolate. So by default, we're usually giving folinic acid, not folic acid, but folinic, which is kind of the raw, unmethylated form. And so that can be very helpful for even MTHFR deficits, just by having that available folate, along with some other supplements that I usually recommend can help with the methylation process. And then we do also test for those folate receptor antibodies in the pregnancy. I just had a mom that was texting me. She's like, hey, even she had a surrogate. She couldn't get pregnant, so she was having a surrogate. She said, "Can we test my surrogate for folate receptor antibodies? And can you order this test?" And I want my baby's surrogate mother to have folate too. And so I'm like, I understand. And so it is important. And I wish I had taken more folate again during my pregnancy. I mean, I took a little extra, and so I was kind of on the right track. But again, I took a ton of folic acid. And so I was taking extra folic acid, and I didn't know at the time that, it was kind of a not optimal dose. Was it, I don't know. I don't know if it did more harm than good. Maybe it did more good than harm. I don't know. But, I would have done things differently, which is, again, why I'm doing this podcast. Because, yes, the ideal dose, usually to answer that question, we'll give a prenatal. There's a few brands I like. I don't know if I'm allowed to say it on here for plugging, but there's a few quality prenatals. Like I usually recommend one by Thorne, has a good one. But there's a few others. And usually it has methylfolate in it. And most of them have like 800 micrograms, which is actually not bad. And then I will usually give a supplemental folic acid, something small, like two additional milligrams, just as a baseline, even without, necessarily any recommendations. And then if they have other issues, folate receptor antibodies and stuff, we can start increasing that dose, kind of depending on the labs. So that's a good folate start.
Are these typically over the counter, or are they prescription?
These are over the counter. The supplements are over the counter. I mean, once you get into the really high doses of folinic acid, I mean, we're giving, sometimes 25 milligrams twice a day. I mean, that's a prescription, and so you do have to talk to your doctor about that, which you should. And I mean, it's like I said, pregnancy, you want to be careful. And so, cause babies are sensitive, so you got to make sure you know what you're doing. But yes, those are prescriptions, but for the most part, you can do enough. I mean, I know there's certain brands out there, I can't think of the name, but you can find 5, 10, even 15 milligrams, I believe, of methylfolate is just a supplement over the counter. So, some parents I know, kind of do it themselves. So,
yeah, that's what I was wondering, because it seems like folate is becoming more aware in the lay public, but there are so many options for the over-the-counter option. And plus, what I've learned from you and Dr. Fry is there's differences that you need to be aware of.
Yes.
So.
Yes. Yeah, they're definitely not one size fits all. So, for most people, I don't recommend those, just to be clear, I don't recommend those high of doses of methylfolate. Like I think 15 milligrams of methylfolate is probably too many methyl donors. I mean, for a lot of people, they may have symptoms or they may not tolerate it. So that's why, the folinic is safer to give at higher doses. Most practitioners are not going to do 25 milligrams of methylfolate. I don't even know that you can buy it. It's just too much. So if you're going to go up higher, most people would choose the folinic, and that's where your doctor comes into play. So, and so to round back, I'm sorry, you go ahead.
No, you go ahead.
Okay. Yeah. And I know we got way off track, but you were asking about testing. And we talked about the folate. I know we talked about autoimmunity, thyroid. There are some basic ones that I do think that, primary care tends to get right. So most of the time they will look at iron, and we'll do a ferritin, like an iron panel. Because iron is quite important, and a lot of moms are low. So that's something to optimize, especially specifically ferritin. We tend to check that and kind of base our labs on that. Another thing, you're going to want to get like liver function, is what's called a CMP. We'll do kidney function, that's all included in that test. Blood sugar. So a lot of the basic screenings are good, because a lot of these maternal pregnancy complications that are common, like gestational diabetes, gestational hypertension, preeclampsia, preterm labor, all these things we see in kind of, frequently are associated with autism, like most of them. So maternal pregnancy complications are associated with an increased risk of autism. So, like I said, in some ways, I mean, I think that I hate to bash, Western medicine. I think that there are some things that they're doing well, and there are some medications that are helpful in the screening portion of it, because we should be somehow controlling these. But it's not all equal. So, for example, like let's say with thyroid, we believe that if you treat some of the hypothyroidism and actually give thyroid supplement, it improves outcomes. For something more complicated, or maybe not as complicated, but more controversial, like depression, what we find is that there seems to be an increased risk of either SSRI use, which is antidepressant use, in autism. And the big controversy is it really the antidepressant medication causing autism in the, in the children? Or is it because the mom was depressed to begin with and it was depression which prompted the treatment for an SSRI? So, so basically certain things like treating iron, treating vitamin D deficiency, treating thyroid can be helpful, but something like an SSRI doesn't seem to be protective for the child for getting autism. So moms on antidepressants tend to have more children with autism. So, like I said, I know it's kind of a, going back around, it's just basically certain tests are helpful, and that's kind of what I'm trying to talk about. And other things are, again, to talk about Western medicine, like certain things like SSRIs are not very helpful. And so you may want to be looking at other things for your depression, especially prior to pregnancy. Why am I feeling sad? Why am I feeling unmotivated? So, yeah. So sorry, I kind of went on a rant there, but I did want to make that clear that certain things help. So it's like, oh, I'm depressed, I'll just go on an SSRI and then I'll get pregnant because I'm not sad. And so that's going to help me. And that's not the ideal way to look at it. That's not what the studies show is helpful.
Whenever I think about depression, I think about tyrosine and tryptophan, something that we've talked about a lot. And they're aromatic amino acids, and they require that UV light spectrum.
Yes.
Because of the tyrosine making dopamine, epinephrine, norepinephrine, and melanin.
Yes.
Which is our get up and go, our drive and anticipation and wanting. And then the serotonin that's, provides that mood regulation.
And to that end, with the testing, I'm sorry to interrupt you, but it's exactly what we test for. So plasma, so what we do in kids with autism and also in pregnancies, we test for plasma amino acids. So really backing up to see, exactly what you're saying is what amino acids are missing. Are they low in cysteine, or are they low in proline and like maybe an autoimmune disease? Are they low in ethylamine? So there's so many things that we can give that'll give us an indication of where the body's struggling. I've seen some parents that are, unfortunately, especially if they're protein deficient with like dietary intake, that are just low in amino acids across the board. If you're not eating enough protein, especially like, vegans and things, it's hard to make these amino acids. So they have, you'll screen them and we tend to see them lower. I have a lot of patients that are vegetarians due to religious beliefs. And so, there are struggles that we have to get protein in because sometimes the labs speak for themselves. And so we can tailor that. So exactly right. We do look at amino acids as part of our pregnancy profile.
I've never considered that.
Yeah, it's very cool. It's easy. And a standard lab will do it. It's great. It's a very easy, it's a plasma. It's just their doctor can add it on there. And it's very informative. I've followed this with my kids. I wish I'd have gotten one during my pregnancy, but with my kids every year, it's part of our annual labs, and I'll see, oh my gosh, yeah, they were deficient in cysteine this year, and this year their connective tissues are struggling, or this year they're looking really good, or this year, we need to bump this up. And it really actually does guide my treatment for them and just kind of guide my overall picture of what's happening in their body. It's very useful. And of course, Dr. Rosendale and Dr. Fry would say it's very useful for looking at mitochondrial dysfunction, because there's certain things like the alanine to lysine ratio. If it's really skewed, then it'll show you that it's not working properly. So that's part of what we do as our mito workup too. And we do see that. We do see it.
Amino acids ought to be one of the top priorities because they're 20 proteins and all other proteins are made from here.
Yeah.
So it makes sense.
Super critical. I love doing them, and because it's a puzzle too. So you look at it, and it's frankly, it's just really fun because everybody's a little different, and so you're trying to look at the biochemistry of it and what and you're pulling out your charts. Oh, if it's low here and here, and trying to figure out what's going wrong. and what you can do to help them, because everybody's body's so unique, and it really gives you an interesting snapshot. Now, sometimes if it has to be fasting, if it's not fasting, then it's not necessarily representative, but it should be fasting. So that's helpful.
Do you know if there are research data on dietary types and autism risk?
So, like vegan, vegetarian,
Yeah,
pescatarian versus autism rates, that kind of thing.
yeah, which might be complicated because there are so many other environmental
That's right.
factors.
That's
So,
right. I don't know. In my research, that's a good question. I'm sure it's out there. No studies are coming to mind, but they're probably out there, and that would probably be a question for another podcast. But like I said, just clinically, I do see that it does impact. It does impact our labs, and and
okay.
especially if you're a vegan with the B12 is and this is this is known in Western medicine. It's like we need to do B12 injections typically, and that's kind of more or less without exception. I mean, there's always exceptions, but it's pretty typical.
Just the whole vegan, because they're not getting the those proteins, and people that avoid protein, animal meat, and fat.
Yeah.
Seems like that's going to be big because that's where we get them. I mean, we make them endogenously, but
yeah. Well, I experimented on myself with this because I'm big into diets. I've been doing like nutritional counseling for, since I was a PA for like 17 years. And so I've tried, I've played around with ketogenic diets and, like low carb, or initially I've tried a low fat diet back in, 2 decades ago when that was popular, which just totally shut down my hormones. I mean, when I was on a low fat diet, my body was not happy. I actually stopped menstruating, and even I went to my OB. I was a kid. I was trying to lose weight for my wedding. And I always like, why? What's wrong with your hormones? I'm like, well, I'm not eating any fat. They're like, that's not working. So, but recently I've actually gotten fascinated by the carnivore diet and this idea of protein only, just because nutritionally it seems so important. And when you have these dysbioses, these things that seem to be fed by grain, at least in my case. So I was learning okay, if I ate grain, I was getting bloated, I was getting tired. I mean, I could consistently kind of track this. I feel like my thyroid was slowing down. So I'm like, let's just try carnivore. So I cut it out, and I felt really good, for maybe 6 months. I mean, I was pretty good about it, and I was trying to do mostly just the lion diet with, mostly beef and some eggs and, but I actually found that over time, for me, it wasn't necessarily good, and it wasn't something I wanted to stick with. Now, everybody's got their own thoughts on this, and it's very controversial, but everybody's body's different. And I found that after a while, my thyroid was actually they were going up. My TSH was going up again. So I thought, I think I need more carbohydrates. So I started to add in more fruits and veggies, and I actually found that things have stabilized a little. So, and even the veggies, I'm kind of not so much into. I mean, I eat some. But, but fruit is good. I drink coconut water. I get juice, freshly squeezed orange juice is delicious. So anyway, my point is just kind of playing around with diets, I think does impact your health. And a lot of kids do well on a ketogenic diet, like we talked about, I think, on the last podcast. But, that's not something we're going to advocate kind of full circle. It's not something we're going to advocate for moms. I mean, I think that a balanced diet in general, I think is better. I do worry about the long-term consequences of, being on something extreme like carnivore during pregnancy. I think that, it's hard to kind of pin down. And so, usually moderation is best, and eat what your belly's telling you feels good, So, so it's a hard one. And like I said, some people are very fanatical about their ketogenic. Some people are fanatic about this or that. So, but everybody's different. Do you do any kind of special diets, or have you tried all that for your autoimmunity stuff?
Yes. I think the best advice I've ever had for food is eat seasonally and at your latitude, because it's all photosynthesis. It's all electrons and protons, just like we're created. Yeah. So if people could just eat in season at whatever's growing at their latitude, they're going to get the best electron proton balance.
Well, and I love that answer, because I've been really I follow a bunch of stuff online, and I follow this regenerative farming, and they were talking about on this last podcast, and they were talking about how it's really, like you said, eating in season, eating with the plants that are the healthiest. And part of that is soil health and the time of the year and really how that's affecting our microbiome. Like, and how we don't need to add minerals. We actually need to add probiotics back into the soil, not so much the minerals, because, when you eat according to these kind of older farming practices, it's really like some of the antibiotics and pesticides that are kind of harming the food. And so anyway, but yes, eating seasonally and eating according to your latitude makes a lot of sense to me. I mean, I'm Italian, like, Italians have some of the, longest, lifespan we know, and they do that. You go to there and everything is just fresh tomatoes. And if it's not, then you don't get that. If eggplant's not in season, you don't get that. And, when you taste it, the food is just rich and, nobody's really overweight there. You lose weight every time you go. I've been 3 times and I just stuff my face and lose weight. It's amazing. So they're definitely onto something with this whole, eat what's around you. Eat what's in season. I love that idea. And I think, I hope we can get here in America. I really do. Yeah.
It seems like that's going to be a change after the election.
Yeah. Well, we'll see. Either way, to me, regardless of the outcomes, I want health. I want health for everybody. And this is why I'm like, well, I'm going to do this either way. So,
our nation is so sick.
I really, all we can do is speak our piece and speak our truth and send, love and health to everybody. And we're doing it. So, that's all you can do. So, I think we're there. I think we're getting there. I think people are ready for this. I'm certainly ready for it. So it's very, like I've told you last podcast, it's very exciting. It's a very exciting time to be alive. I'm really grateful. I think I think it's going to be fun.
Yeah. So after pregnancy, after birth, what are some of the more interesting or some important items that you find?
Yeah, so that's a good question. And one of the big things is that we learned with the, obviously the pregnancy, I didn't mention this, I think I kind of roundabout did, but vitamin D, and we talked about sunlight a lot, but a lot of times, if you do have a pregnancy that's you got pregnant in January and you live in, New England, and you're not going to get as much vitamin D, so what do you do? And, we do find that supplementation is helpful, and that increasing those levels does seem to correlate with increased health. It's not, the gold standard of how we're supposed to be living, but I think it is a viable substitute for what we have right now. So normally with babies, we're going to usually just recommend some vitamin D, something very low, that, it's, usually 500 IUs a day, depending on obviously the size of the baby. And this is not medical advice, but something low, vitamin D3, and a lot of times, especially if the baby's having any issues with bloating or diarrhea or constipation, then we can recommend like an infant probiotic. That can be helpful. And some babies too, I tend to recommend, if there was a history of any kind of autism or whatnot, is some DHEA. DHA. Basically, the omega-3. They make some infant formulas for those omega-3s, but specifically the DHA. There's 2 components. There's the EPA and the DHA, and the DHA is more for brain development. So we give a little dose, if the mom's concerned or wants to do it. But, for the most part, again, it's really optimizing those things that we talked about for health. So breastfeeding your baby for 6 months, that's key. It really seems to be helpful. So even if I know so many moms reach out to me, and they're like, I'm worried about toxins in my breast milk. They're like, I'm trying to be clean, but gosh, what if it's got metals or Roundup or this or, the glyphosate, this and that and the other thing. I'm like, look, studies have shown even regardless of that, there's so much, it's liquid gold. There's so much health benefits to it that it's going to be better than anything they're going to get out of a can. That's just how it is. And so, there are risks, and ideally the mom, while she's breastfeeding, yes, those toxins that anything that you're ingesting will come out in breast milk. So, you take antibiotics, your baby's going to get some antibiotics, but it's still better than what they're giving us commercially, out of a powder can. So there's that. I'm sorry?
There's some controversy over the baby formula.
Yeah. Well, my understanding, and I'm not an expert on this, but my understanding is that they have to have some kind of, like omega-6, like seed oil kind of thing. And like there's none commercially available that doesn't have any seed oil. And so I've actually had several parents reach out to me like, what brand can I get? And so I'm like, well, it's hard. There seems to be nothing without a seed oil in it. So, obviously we're trying to lean towards non-GMO and organic, and you got to read the labels. Some are definitely better than others. But yeah, it is hard to find a good option. There are more options available now than there was when I was, breastfeeding, when my kids were babies. Gosh, there was like, a few cans. I mean, there wasn't much. I wish, like, I actually breastfed as much as I could. I had to pump because I had 3 babies. So I actually had to pump half the time, and then I had to alternate. So some kids would get my breast milk, and then some kids would have to get the formula. It was about half and half. And my kids, it was so sad too. It broke my heart because when the kids would get my breast milk, they'd be great. And the kids would be happy and, they're no bloating. And then the kids would get the formula, they'd be bloated and crying. And my one son preferred my breast milk so much that he didn't want to take it, but I couldn't make enough for 3. So It was really frustrating. At one point we'd looked at a breast milk donor and it just didn't work out. And so it was a tough situation. I mean, most parents are not going to have that hard of a time, hopefully, some women, and I tell women, you got to keep trying. I had a hard time initially producing breast milk. So I remember I had a horrible experience where I was in the hospital, and for some reason it was after my C-section, and my milk, it just wasn't coming in. And I had a lactation consultant, and I had just had a C-section with 3 babies out, and it hadn't even been like 12 hours and my milk hadn't come in. And she was literally yelling at me saying, you have to try harder and you need to be breastfeeding these babies. And I started crying. I just was sobbing in my gown with my sutures, and my husband came in. Oh man, he yelled at me. He's like, get out, because, they were beating me up. It was so awful. So it took me a little while to get my breast milk in, but I kept at it, and eventually I did. So I know some moms are like, they have a hard time, and I just tell them, just keep trying, get a lactation consultant. It is important. Sometimes they can give you tips. There's theoretically some supplements that I don't normally recommend, but I know some of these lactation consultants can. So anyway, yeah, it is important, and don't let anyone yell at you, but try your best. So yeah, but yeah, so that's big recommendation. And then everything else is just what we talked about. If obviously babies they shouldn't really be getting water unless you're mixing it with formula. In which case you want to do the RO water, reverse osmosis water. Yeah. Obviously don't mix that with tap water. If you're near a freeway, or I'm a big fan of air purifiers. I got big quality air purifiers in most of my house because we do live in urban areas. So I try to keep those, the air quality as good as I can, changing out the filters. We talked about organic, non-GMO diets. Plastics are a big deal. So just make sure that, I tell moms, don't microwave anything in plastic or styrofoam. You don't want to heat up those kind of plastics because phthalates have been associated with autism and pregnancy, kind of those plastic softeners. So not good.
Plastics is interesting for even pre-pregnancy, maybe.
Yes.
Because it's shown that it implicates pregnancy.
Yeah. Yeah, I'm a big fan. I mean, in my house, I'm kind of I'm really, really strict about, what we have. We either have glass or stainless steel. And we have some like ceramic, obviously, like it has to be non-chipped, or theoretically it can have lead. But I mean, I really try not to have any kind of plastic that we eat with, cook with, that kind of thing. Because, I do think it matters. I mean, plastic's everywhere. And if it's just the difference of me buying some different kind of plates, or not using disposable, not microwaving with disposable plates that have that lining on there, you heat up food in it and then you're just eating it and it's all melted. It's like, that's not going to be good for your health, and it's an extra dish. I get it. But, it all adds up. So, some of those things, glass is great for cookware. So kind of avoiding those household things are important.
Yeah. It's hard to avoid. It's hard to avoid all these identified risk factors that are coming out.
Yeah. Yeah, I mean, even the vinyl on the flooring, because everybody's floors are now made out of vinyl, and like that can have, it's like your feet are grounding. You're big on grounding. The feet, they're grounding to vinyl. and you're going to be absorbing those toxins. I mean, the feet are a big conduit for, people just think like your feet are inert, and they don't really interact with the environment. But of course, we know that's not true, especially
Yeah, we got those
barefoot.
big glands.
Yeah, yeah. So,
Mhm.
what you're walking on matters. The coatings that they put on carpet now are all these flame retardant coatings, right? And so, because they don't want the carpet to catch on fire. So, if you get a brand new carpet, you're probably absorbing that. I mean, people don't think about it.
Yeah.
And I didn't, but now when you look at it, you're like, oh, yeah, I guess that would be a thing. And so, and as a flooring in a house, I mean, if you're not renting and you can afford it, then, yeah, I mean, solid wood's better. Or tile, like some kind of a ceramic tile, that's good. I mean, even concrete, depending on what kind of coating you're putting on it, it can matter, but
Yeah.
so yeah, it all matters. And, so those are kind of the basics. And I didn't read this in a study or anywhere, but I love your idea of sunlight. I mean, I think, parents are so scared to put their babies outside, and I know some of it's cultural. But, some of the healthiest babies I know are all tan. I mean, we just, you go to Florida and like there's just babies out there that are all brown and they look really happy, I think, from the sun, and,
Yeah. Wow.
and I think that's a good thing. Call. It's like, take your baby outside, go for a walk, get some sunlight. I think it's healthy. Yeah. I love that.
Leptin wasn't discovered until 1994, and that's its role. It's absorbing the sunlight and it's feedbacking our metabolic accounting. It governs our metabolism. And that's why babies are so fat compared to like chimps or monkeys, even though we have 99% genes. It's because for our development compared to other mammals, it's because we come out fat so we can interact with the environment in the sunlight, and that's what accelerates us. So it's wild.
I don't know, but it sounds interesting. Like it's totally a good theory. I mean, it's like you said, it's hard for me to believe that sunlight is not healthy. And, it's interesting because, I see people that live indoors and then they avoid the sunlight. But then when they go out in the sunlight, they get burned, right? And they're like, oh, see, I got burned. I got these spots now. I should have never gone out in the sunlight. And it's interesting because this summer we spent some time in Florida. I was seeing patients, and there was these workers that are on Daytona Beach shores, and they're the gatekeepers for you can drive up on the beach. It's super cool. So they take your money and they give you a tag. And these ladies are literally in the sun for like 8 hours. They work this toll booth. They didn't even have a hat on, and I don't see any sunscreen. And they're just standing there. They're there all day, and they're smiling. And I didn't see one sunspot. And I looked over my husband. I'm like, this lady's in the sun 8 hours with no hat and no sunscreen. It's amazing. I'm like, how did she get there? I almost wanted to pull her aside and be like, what's your secret? Like, your skin looks great. Because like I said, I see people over here in Southern California, they go outside for 2 minutes and then they're burned. And, like I said, they have all this hyperpigmentation, and it's just, obviously the science behind it's complicated. But I mean, to me, that is a sign of health, and that it seems like that's an appropriate immune response. Whatever that lady's doing is something we should be striving for, right?
The rates of sunscreen cells and melanoma are identical. It's like sunscreen is causing it. And I tell you why. Because red light is always out if the sun's out. The sun is 43 to 48% red light. Red light preconditions us, prepares us for the UV light.
Yeah.
And people aren't getting that like morning red light or enough red light. And then they can't sustain sunlight. I haven't worn sunscreen. I used to a lot.
Yeah.
I haven't worn sunscreen for 2 or 3 years. And I have vitiligo, which is one of the autoimmune problems.
Yeah.
And I can go out July, August, vitiligo. I never wear sunscreen anymore, and I don't need it.
Yeah.
It's wild.
It's wild. It is wild. I mean, I've heard some claims, and I have no way to substantiate this or not because I don't know if it's true. But some people were saying that if you remove seed oils from your diet, that you won't get sunburnt anymore. I don't know if that's true, but it was this big post. This was a couple months ago, and it was circulating all over my feed. I've never actually tried it, but I do think that there must be something to, like you said, the inflammation component and just the immune response that's supposed to be natural. I mean, we're supposed to be in the sun all day. So what's going wrong? What's wrong? And I mean, is it the vitamin D deficiency causing it? And do we have to slowly increase that exposure or have that exposure from birth? I mean, like you said, I know this is your wheelhouse as far as the science of light, the study of light. But I don't know. It seems like living in a box. The way we are doing it doesn't my body just doesn't like it. I get very antsy. I have to jump up. I go for a walk every day. I'm always like, outside when I can. I feel like, it drives me nuts. I have these, I'm like everybody else. I always want to have a farm, and I imagine myself being outside with my animals and being in the sunlight, and like that's like my bliss. Or being at the beach. Those are like my two bliss like ideas, and both of them involve like full sun. And like I can't imagine a happiness where I didn't have full sun.
Yeah, that's where we evolved.
Yeah.
And I'll tell you, beta endorphins is involved with that.
Yeah.
In POMC, in hypothalamus in the POMC. Beta endorphins and melanocytes. It's wild. That connection is so wild.
It is wild. I mean, you can almost feel it. I mean, I don't know about you, but I'm I feel like I'm pretty in tune with like, because I got 3 kids, I'm pretty in tune with my emotions, and man, like I just relax. Like, and it can be almost instant. If I'm having a bad day or I'm tired or whatnot, I just go out in the sun. Thankfully, I live in a place where there's a lot of sun typically. So I just go outside, lay out there, and man, my stress, there is just nothing like a stress reduction for me.
No,
just 5 minutes of direct sunlight. I'm like, oh, and my kids know, like, oh, that's mom. She's just sunning herself. They kind of know. And it's interesting too, because my kids do it a lot. Especially when they were younger. I would know, we lived in San Diego, and I would know, and at the time, I think I told you the story when they regressed that we had found some mold in our house, and they were really kind of pale, and I would find them, and they would just they'd go outside, they'd let themselves out in our backyard, and they'd just be all 3 of them laying out in their diapers or what, and just like flopping in the sun and the grass. And I'm like, that's interesting. And they just kind of like look at me, and I'm like, wow. And they would go do this every morning. They just kind of flop outside. And even like my mom was like, that's kind of interesting. I'm like, they like the sun. So they still do it. They still like, they crave the sunlight. I mean, they're little sun babies. I would never want to move them to a place that was dark. They'd be really sad. So yeah. So I don't know. They know. They seem to know. They knew what they were doing.
Yeah, that it's the opioid and the cannabinoid. It's directly attached to that. It's amazing.
It is amazing. Yeah, I think you're onto something there. Yeah, my brain starts to race as to like, the other implications. But anyway, I digress. So in conclusion, let's see. What I think we talked about kind of the big things, the environmental things, getting the basic biomarkers done. I think I hit on most of them, like, thyroid, iron, inflammation, autoimmunity, folates, amino acids, basic supplements. We talked about vitamin D3, fish oil, like omega-3s. I'll throw in there folinic acid, a prenatal with iodine. Usually I'll throw in some calcium, magnesium too, can help with the mineralization for the babies. And those are kind of baseline. If we do test them on for carnitine for the mitochondrial component, I can give them some acetyl-L-carnitine as well. That can be really helpful for brain development, to utilize those fatty acids and as an antioxidant. But yeah, I mean, those are kind of the main things. I mean, a lot of it's just making sure that you're addressing some chronic issue that you've kind of been not really thinking is a big deal. Certainly fertility, my take home is just that, had I known, I obviously got fertility treatments, and I think that I probably, now looking back, could have done it a different way. And I wish I had, and that's okay. I mean, we know. But if you're having fertility issues, seeking alternate providers, medical providers, instead of just jumping to IVF or IUI or some kind of hormone replacement. Because there is a lot to look at. So, I think that's about it. I mean, I think I'm trying to look at a little cheat sheet here, but yeah. Do you have any other questions? Anything else you want to talk about?
There's a lot of great topics. So
I know, so it's an infinite amount.
So hopefully people can have some good take-home messages with this.
Yeah. Yeah, it's really, like I said, it's the, for me, the take home is it's really important. Again, maternal knowledge, increasing maternal knowledge about this
And not
decreases
to
your risk of
stress and freak
autism.
out about it.
Huh?
And for others not to stress out and freak out about it too.
Yeah.
Just use this as information and
Information, and heed my warning, the stress is a big deal. If you're at work and you're trying to get pregnant, you're pushing something too hard, we pushed for fertility, and I was trying to work during my triplet pregnancy as a physician assistant. My body was like, oh no, that's not working. Like, and so, just listening to your body, relaxing, what's meant to be is meant to be, trying your best, live a healthy lifestyle, but, yeah, just, going with the flow, get sunlight. I mean, go outside, take walks. I mean, some of the things I walked every day during my early pregnancy, and in San Diego. And I made sure that, I love doing that. So just listen to your body. And yeah, it's a journey, but and again, if we're here, if anybody needs it, I did want to mention too that I have, it's more or less this talk. It has more examples and specifics in writing on my website, NicoleRincon.com. I have a TACA presentation that I did several years ago talking about this. So if they wanted it's in a PDF format, then you can access the website to look at pregnancy recommendations, in writing.
Oh.
So I have a pregnancy talk on my website. And yeah, of course, like we're here, if you need a consult or want to talk to somebody, then we do that too. So
That's fantastic.
good.
Let's hopefully we can have some more discussions on here.
I know, right? It's fun.
One about GI alone and stuff like that.
Yeah, that'd be wonderful.
Yeah,
it'd be fun to talk about.
Well,
all right, Brian. Well, I'm going to go to a concert tonight with my triplets, so I'm very excited. It's their first one we're going to go to, so I'm going to go to the Hollywood Bowl. So they're very excited. So it's going to be fun.
Oh, that's
they're 12,
cool.
So now they're ready to be cool.
They're doing okay with the autism and stuff.
Yeah, I thank you for asking. My one son, we just had his IEP meeting on 3 days ago, and they just said, look, he doesn't have any autistic symptoms. He just lost his diagnosis. And I agreed with it. He's like, he has no supports. He's in gen ed. He's getting mostly A's. He has friends. He's doing great. So we just took away his IEP, which is, oh my gosh, it's just, I can't, it's a blessing. I never thought we'd get here. And, yeah, my other son, he's in gen ed too. He actually just got all mainstream this year. So he's in all gen ed, and we're working on his social a little. And he has a little hard time making friends. This is not on topic, but we could talk about it next time. Is we're working on a little oxytocin, talking about hormones.
Yeah, I want to talk about oxytocin.
Yeah, I knew you would. So
the monocellular and parvocellular paths, they're vastly different.
Yeah, so we're thinking about adding that in, but cognitively, he's doing great. He's very sharp. He's testing well, and his speech is great, and. So yeah, we're trying this oxytocin, and so it's really fun to be able to, do it as with my family, with my kids, and also so I can talk about it. And I'm not just recommending something that we're not doing, and this is my experience, and we tried this, and this didn't work, but then we did that, and that was good, and so it's very much just we're in this. So, but yeah, the family's doing great. I'm super super blessed. They're turning into teenagers, which is what you want to see. They're getting too cool for school, which is super appropriate, and I'm like, oh, yep, there it is. So, I think it's a proud mama moment. It's one of those things that you're like, they're talking back, but it's super good. I mean, you want to see, I'm like, hey, yeah, I'm glad that you're, wanting to be independent from me, so, it's a blessing. So thanks for asking. How are your kids?
In a couple of years that they're not going to want or need you, and you're just going to be a big embarrassment, which is what I'm going through right now.
Right.
They don't want or need me, and I'm a big embarrassment. So
good. Like I said, it's good. It's normal. You want them to be their own people. I want them to go out into the world and do whatever their heart desires. Yep, you got to leave the nest. Good.
But at the same time, it's we're the little kids that
I know. Well, that's why you got videos and pictures, and I embarrass them all the time. Look at this video. This was you. I'm one of those moms, Mom, put away the video. So, You get to relive it.
impossible not to be like that
I
as a
know.
parent.
They change so fast, and it's like an instant. It simultaneously, it feels like a lifetime, and it feels like an instant. It's such a weird phenomenon, because it's like you remember them. Yeah, you remember them, these different people, and yet you expect them to be this size again. I mean, I remember my baby's like 5 pounds, and you just hug them, and it's and then now they're staring at me like, "Mom, can you close the door, Mom?" I'm listening to music, Mom. So yeah, it's wonderful. It's the best thing. The best thing that ever happened to me, my kids. I mean, my second to my husband. I mean, obviously, like, my husband comes first. I love him. We have a great marriage. The kids are just they're all important, But yeah, it's just amazing. Kids are amazing. I love kids.
Yeah. Well, thanks for coming on, especially on the Saturday. And,
thanks for having me.
Prepare for that time change and the darkness.
Less sun, womp womp.
Well, we'll interact some more. I'm looking forward to it. So thank you so much.
Good. You're welcome, Ryan. Well, have a good weekend.
Thanks. You too.
Okay. Bye.
Bye. If you are listening to the podcast or listening to the episode, please feel free to leave a review or ratings. In podcasting, review and ratings are crucial, and I very much appreciate your feedback. You can contact me on X at RPS47586 or click on the hop link so you can have links to all the show platforms and contact information. You can email me info.fromthespectrum@gmail.com. And thank you for listening to From the Spectrum podcast.